Have you ever thought about the idea of having your own DOT consortium, whether or not that idea is even possible? Well, we're going to talk about that today. Not only is the idea possible, but it is a very lucrative idea. It brings more authority to your practice and it increases revenues, employers, and drivers all at the same time from one basic plan and one basic strategy. I'm Michelle Brown, Regional Vice President of Federal Certification and Training Programs for DOT Health Systems. Before we get started, I'd like to talk to you a little bit about DOT Health Systems, who we are and what we do. Since 2012 all the way through current, we've provided certification training on physical exams for more than 2,000 medical providers nationwide. We were the first organization also to help private practice doctors set up their drug and alcohol testing programs because most private practice doctors thought that starting drug and alcohol testing would be very, very expensive. We found a way to help private practice doctors get started with drug and alcohol testing and add that to their practice while they're also doing DOT exams. We will now be the first organization to help not just private practice doctors, but also small clinics set up their own DOT consortium to ensure that they're getting the most value out of working with drivers and employers all across the country. So we're very proud of that. We've learned that our private practice doctors and our smaller clinics do not have access to the same information for getting things set up. And so over the years, we've looked at ways to help our healthcare providers in small practices and small clinics and private practice doctors compete in the market of occupational health, specifically as it relates to the federal government. This DOT consortium will allow your practice, if you're really wanting to do this, to compete with third parties and any other types of organizations that are coming to you to use your services, but yet you're not getting the value of working with some of these different organizations and agencies. So the idea of the DOT consortium is to help you maximize your situation in the DOT occupational health community. So what it's like today, let's start there. Today, you're getting service requests from different agencies like TPAs, consortiums, employers, maybe even other organizations like iHire and other types of laboratories that are requesting your DOT drug and alcohol testing services. Most of them will not give you the exams because they may have nothing to do with the exams. And even if they do, they may not give you the whole package. They may give you a drug test here, an alcohol test there. I don't have to tell you because you know how that works. But this is what it looks like. Right now, a lot of your drug and alcohol testing activity is coming from different directions, different entities, hiring organizations, employers, consortiums, and TPAs, and sometimes, many times, other laboratories. So you need to consider, where is my activity coming from? And how can I capitalize on that? And how is it helping me? Is it helping me at all? Am I, negotiating rates for much lower than what I'd prefer to do? So if I prefer to offer $35 for a drug test and I have a laboratory that asks me to do the collection for $8, what value does that bring to me? Those are the questions you should be asking. So here's the problem. This is how it works today. Today you have employers with drivers, of course, that will pay upwards of $239.88 per driver to a third party. That third party comes to you to get the drug and alcohol testing services because that third party does not provide any of those types of services. All third parties do in most cases is they organize and they utilize other entities' services to service their clients. So the third party is going to come straight to you. You will fulfill the drug and alcohol testing, and in most cases you will not get the physical exam because they're not focused on the physical exam. they're only focused on the drug and alcohol testing for the employer, you get approximately $20 per driver and your profit is minimal. That's how simple it is. That's what's going on behind the scenes. Behind the scenes, you have to consider this driver, or I should say this employer with drivers, is paying this third party $239.88 on average per year, not per test, per year. And we'll talk about the pricing structure and how that really works for a lot of the third party organizations. So what's a driver worth? Today, one owner-operator driver's value is approximately $35. That is equivalent to one drug test annually, or I should say, or an alcohol test. If you're lucky, you can get both. But most of us know you only get one. So you're talking about from a consortium or a TPA, you're getting one drug or alcohol test, or maybe both. So your total value could be approximately $70 depending on what you're charging the consortium or the third party. Now, the reason I use owner-operator is because this is very key. Most of the drivers in this country, out of 7.8 million CDL drivers, most of them are owner-operators, meaning they own their own truck. The myth that large employers have 200, 300 drivers, sure, they have 200 sometimes, but there are not very many employers like that. There are only a few. And the reason there are only a few is because a lot of these large employers contract out to the owner operators. And so if the owner operator is independent, then they are not getting their instructions from the large employer. They have to take care of it themselves. So owner operators are extremely valuable. Eventually, owner operators hire other drivers. But here's the most important thing. If you had your own consortium, instead of this owner operator, or instead of one driver having the value of $35 or $70 per year, you would have one driver, one consortium driver, whether they're owner operator or not, valued at $314.88. I'm going to show you why and how. Remember, the money from the employers goes directly to the third party, which I'm sure you knew. But if you were to take out the third party, just eliminate them completely, your value would increase, your profits would increase, the number of patients that you have, the employee patient drivers that you have would increase, everything would grow because now you have control of the situation. So this $20 that you're being paid would suddenly turn into much more than that. The solution? This is how it can work for you. The employers with the drivers, they come directly to you. I know you're thinking, how do I make that happen? Well, that's why we're having this discussion. What if every driver that you encountered paid directly to you the $239.88 or more, or a little bit less, directly to you as the service provider, which is the way it should be in the first place. Consortiums, TPAs, third parties saw a need for organization. They saw a need for a third-party service, so it was created many years ago. Now we're more sophisticated and we understand how to make it happen, how to get the employer in the circle with you, directly connected to you. We at DOT Health Systems understand how to make that happen. Therefore, if you do that, you're going to have increased profits and sustainability, without a doubt. So how do I make it happen? How do I create my own consortium? Before we begin, we need to discuss what it takes to have a successful consortium or TPA. First, you need to understand, as the consortium, you are the center of everything. Once you bring in an employer, for instance, your first employer could have 40 drivers, your second employer has 10 drivers, your third employer has 5 drivers, and you continue to build. Every employer, even owner-operators, are going to represent 1 to 2 drivers. You bring them in and you create a pool. Now, some of you don't have enough drivers to create a big enough pool, and if you don't have enough drivers, it could frustrate the drivers because they're being tested all of the time. We have a solution for that as well. But once I complete my circle, I have a good solid foundation of drivers, even if I'm just starting with 40. We have a solution to help you figure out how do you make sure that you're balanced within a pool. What you're doing is creating a nice size pool so that all of the drivers are being tested. Not tested too often. That's the success of some of the larger consortiums. They don't test too often, but they can break the pools down. In this case, we're talking about a pool of 200 drivers, which is a nice size pool. So with 6 employees, we have, or I should say 6 employers, we have 200 drivers created, right? So when we do a random, all of those drivers are not going to feel like they're always being tested because it's balanced based on the FMCSA DOT drug and alcohol testing rules. It's called randomizing. So once they're randomized, it has nothing to do with reasonable suspicion or pre-employment. Those are different. And if you decide that you want to set up set up a consortium, we would help you to understand how all of that works. But these employers act as the owner of the driver's drug and alcohol testing situation. And you're putting all of them together in a pool. You could pull out reporting for each one of these employers. You could pull out testing results for each one of these employers, but yet you're managing them as a pool. This is the key to you having a successful consortium. All you're doing is taking general information from the employer groups and combining it where you need to and separating it where you need to. And that's where we would help you. So don't stress out about the idea of managing all of these employers, but you need to understand that you would use all of this information to make your program successful. Also, keep in mind that if you are certified to do drug and alcohol testing, you could provide drug and alcohol testing for any agency. And the reason I say that is because you should understand that FAA has consortiums. The pipeline agency has consortiums. As you know, of course, we're talking DOT CDL for FMCSA. They have consortiums. So there's some consortium organizations that specialize only in one agency, or some of them specialize in 2 or 3 agencies. You could be the same way. Maybe you get a lot of FAA pilots that come in to talk with you or that want you to do their drug and alcohol testing. You could have a separate consortium for them. So the success of a consortium is to bring the employers in or bring the individuals in that are required to have the drug and alcohol testing. That's the key, is understanding who is required to be drug and alcohol tested and who is responsible for making that happen. So here's what's happening in your practice today, working with consortiums and also working with drivers directly. You as the provider, you are working with drivers that walk in, come in, or they call, or however they get to you. They give you their DOT exams. That's all they care about when they come in. Unless they are in an owner-operator position, you would not know the difference. They come in to get their physical exam. If you're not asking questions, you're not doing a small intake form to find out, are they an owner-operator? Who do they work for? You assume they're just a driver. Sometimes you find out if they're an owner-operator, but that's part of the strategy. You need to know who's walking through your door. So all you get is an exam. You next will receive service requests on the other end of that spectrum from consortiums and TPAs and sometimes employers calling you directly to ask you for drug and alcohol testing, which is great. But do you see how all of these are separate and apart? All of this should be together, meaning any driver that walks through your door should be a target for drug and alcohol testing also. And I know what you're thinking, how can I do that if that driver is not responsible for their own drug and alcohol testing? Well, I'm going to teach you that you need to think differently, and you need to look at every driver as that $314.88 value that I talked to you about. So what will happen with your consortium? How will it be different? If you have a DOT full service consortium, you need to think different. You as the provider should be thinking about not just how do I get the drivers in, but also what am I doing with the drivers when they come in? Right now you're just doing the exams, right? You should also think about how do I get to that drug and alcohol testing specifically for that driver. Then you're dealing with the employer, one off here or there. You should be thinking about how do I get from that employer drug testing, alcohol testing, which they're already going to give you, but also the physical exams. Your mindset should be no matter where that driver is coming from, you want to get all three of those services. You should be striving to provide services, no matter what, for every single driver, all of these three things: DOT exams, DOT drug testing, DOT alcohol testing. You should look at every single employer and every single driver as the opportunity to provide all three of these services, plus others that you may be able to provide. Okay, so let's take, for example, owner-operators, 100 owner-operators as a goal for your practice to be with your DOT consortium. So if you take 100 owner-operators, the reason that they are a great goal to have is because they're the decision makers. They are very involved in the business. More than likely, they're going to grow from 1 or 2 drivers to 5 drivers, in some cases 10 or 15. I see it all the time. But if you get to know these owner operators as your base, you probably already have some that you've done DOT exams for, but if you don't have a marketing strategy or a plan, then you don't know that they're owner operators. They may work with some of the larger employers like I talked to you about, but the point is that what if you had 100 of those owner operators? Most of the time, the consortiums will allow them to get into the program at a small price if they can't pay in full, because some of them have 5 drivers. So that could mean they might have to pay $200 or $239 for 5 drivers at for one time during a year. But a lot of the consortiums and TPAs are smart, so they give them a monthly membership. And that's the route that you need to go, is to provide a pricing structure that is easy for them to get into and still be in compliance. So let's just say we were to look at, as an example, $19.99 per month per driver. If someone has 5 drivers, they could afford that, because you have to realize these drivers have so many other financial responsibilities. You have to think like your patient, like your customer. And because they have so many other financial responsibilities, sometimes they just see everything as a burden. You don't want them to see your situation as a burden. You want them to know that you're there to make things easy for them. So if you were to offer them a pricing model of $19.99 per month, or maybe a little bit more or a little bit less. It depends on your market and it depends on you. If we were to do $19.99, we're looking at least per year, we're still looking at the $239.88 per year per driver. That doesn't even include the physical exams. That's how we get to that $314 number. It's going to be a little bit more or a little bit less, but you're looking at the whole person situation. Okay, so if we were to do that, if we have 100 owner-operator employers at $19.99 per month, we're talking about $23,988 per year of income that you did not have before, that you would not have. Okay, you would have had, if you had done 100 at $35, you're looking at $3,500 a year versus $23,988 per year, all because you changed your strategy and your thinking. Okay, then that doesn't even include the $100 at $125 per year for the physical exam for each driver. So we're talking 100 times 125 per year. That's another 12,500. Now, of course, that depends on your pricing. You might only charge $65 for an exam. It doesn't matter what you charge. If it's $65 for an exam and you have 100 owner operators, you're talking about $6,500. It's still different than only $65 per exam that you may or may not get. So you're thinking longer term, you're thinking bigger picture. You're doing less work, but you're offering more of a service package. So what's a driver worth to you? Let me just really nail this down for you. And yes, I keep talking about the numbers because unless you understand these numbers, you're not going to understand how to exponentially grow your practice in the DOT occupational health environment. So today you're talking about, let's go back to that $35 for one drug test. And again, a lot of your activity is one-off. It is not strategic. It is not coming together as one whole driver, the value of one whole driver. But let's say I decide that I want my consortium. I'm going to charge $19.99 a month for the drug and alcohol testing scenario. Now that doesn't include other items that you could charge for, but let's just stick to the point. So $19.99 a month, that's $239.88 a year for drug and alcohol when this driver needs it. Okay, whether they're owner operator or not. And then if I add in what I charge for physical exams, $75, that's $75. Yes, that's once a year. But if I'm doing the same exact thing for all of my drivers, I'm going to get a $314.88 value out of each of my drivers annually. So every time I add a driver to my portfolio, whether they come through an employer or whether they come through as an owner operator or whether they come through as a regular driver, because I'm going to know what every one of my drivers is doing, meaning who they work for, if they work for themselves or if they work for a large employer. If they work for a large employer, sure, the large employer is probably managing the situation. But if they work for a large employer and they're an independent contractor, the decision is with them. Period. And we teach you what questions to ask on the intake form. But this is how we get to our $314.88 value per driver. Now let's look at what an employer is worth to you. Today, an employer, TPA, or consortium sends you one driver at a time. Even if they send you 100, you're still only going to get $3,500, and you're still missing out on other services that you could provide for the employer, either directly by offering them both drug and alcohol or through their drivers. Regardless, the value of an employer today is maybe $35, same situation. You know, maybe a little bit more, but it's not double-digit thousands for sure. So let's just look at this situation. What we've done here is we've given you scenarios with 2 to 5 drivers, 6 to 10 drivers, or 11 to 20 drivers. So if we were looking at 2 to 5 drivers, we're talking today's value is from $70, and that's if they give you drug and alcohol together, to for one driver, all the way up to 5 drivers at $175, and that's if they give you drug and alcohol. Okay, so it's such a minimalist situation that you really need to ask yourself, you know, why am I doing this? What if you get a driver for a drug exam, drug testing exam, which is only $35 from a lab, but the lab wants to talk you down to $8. These are the things that are happening. So you need to consider also the fact that if you turn into an employer consortium, a DOT consortium, you're talking about going from $70 with 2 drivers to $629.76 with 2 drivers. All the way up to, if you have 5 drivers, all the way up to $1,574.40. Okay, and then if you were to include the exams, you're still looking at that average of $314.88 per driver. So this is how you need to think about it. What is the driver worth to you? What is an employer worth to you? Now, the reason we have a separate employer worth chart is because an employer that has 2 all the way up to 20 drivers, it becomes very lucrative. You just get one employer with 20 drivers, that could all the way be up to $6,297.60 per year per driver. Because if you have 10 of those or 10 employers like that, you've increased your income to $62,976 a year. Now remember, these are examples of what could happen. But let's say your goal is to get 10 DOT consortium employers, meaning 10 consortium employers with 20 or more drivers. You're talking a minimum, depending on your numbers, could be a little bit more, a little bit less. But the point is that 20 drivers could bring you annually $6,297.60 because you're looking at the situation different. Okay? So you need to realize how you're doing it today. And I understand that we had to do it that way in the past, but we don't have to do it that way anymore because now we know what to do to make things happen differently. So how do I do this? How do I create this DOT consortium? How do I make this happen? This is what you need to make this happen. First, you need a software program that can track DOT testing, reporting, and everything to keep the employer in compliance. That's the most important thing about the program. This is why many of you have not started, because you don't know how to work with the basic foundation, how to create this. But consortium management is a huge part of the program, and that's what DOT Health Systems would do for you. When we say we've made this easy, it means you do your part and we do all the rest to make this easy for you to manage. So you have the consortium management side. All you would need to do is upload your drivers and any testing information that you get. Also, we, through the consortium management, would create the random testing for you for each employer, and all you need to do is follow it out. So if we tell you that employer number 1 needs testing for 4 drivers, you would simply go ahead and do the testing and report it into your system, because you would have access to the system, and all of that information is combined together for your reporting. You would track all of the testing, meaning we would do that for you through the consortium management system. Then you would create testing reports through us. We would give you those testing reports so that you could give those to your employers, because this is why they have the consortium or the TPA in the first place, is for the reporting and the testing. The drug and alcohol policy, we give you that. You need to understand the drug and alcohol policy, which we teach you and train you on it. You need to know the highlights and the levels of, for FMCSA, how it's random, meaning, that 50% of the employees need to be drug and alcohol tested within a certain period of time on a regular basis. Those are the kinds of things you need to know from a high level, but you don't have to write the policy. We give that to you for the employer. If the employer needs a little bit more training for reasonable suspicion training for a DEER, we could give that to you as well, and you can provide that to the employer. So really, you don't have to do anything except make sure that you are doing what we give you to do when it comes to the randomizing for the drivers that need drug and alcohol testing. So what's the second thing? You need a service pricing model. We would help you figure that out. We give you a basic structure, which we believe in the membership-based pricing. You could do the annual if you want to, but membership-based pricing works because you need your owner-operators to be able to get in easily. If you can make it easy for them to get in, they'll go with you, especially if they like what you're doing already. It also provides monthly payment recurring income. So you'll be receiving recurring income from not just the owner operators, but from all of your employers. So we work with you on the best structure. We give you a model and you just basically plug it in. You need to make it competitive. So you need to go by your market because remember, we're national. So we look at all of the different states. Also, you need to make the program unique. I mean, do you want to include drug and alcohol with the DOT exams? For instance, if they come into the consortium, will you give them a discount for all of their DOT exams for all of their drivers? Will you give them other programs or other services? So you need to think about what is unique about your consortium. You could ask them too, some of them, what is your consortium doing for you right now? And you could add something additional or make a change and make it better. We give you the layout, we give you the model, so all you have to do is plug in the information. Discounts for DOT exams, I already mentioned that. You could include that if you want to. But your pricing model is basically for the drug and alcohol testing. You also have to decide if you're going to include additional costs for additional drug and alcohol testing. Now, what do I mean by that? Well, a lot of your competitors in the consortium market, they only cover in the membership model the drug and alcohol testing. Okay, but they do not cover they only cover the random drug and alcohol testing, but they do not cover reasonable suspicion, so that could be an extra charge. They do not cover pre-employment. That could be an extra charge. And so they're going to come to you because you're their consortium. You're managing their drug and alcohol testing program. So that's up to you. But in the program, we would talk to you about that when you're getting set up. Number 3, you would need to create or have a process for all of the employers and the drivers, which we would give that to you as well. You'd need an announcement to let everyone in your practice know what you're doing, all of your patients that are DOT related, all of the employers that you've ever worked with. The consortiums, of course, you would leave them out because they are now going to be your competitors and you don't want them knowing what you're about to do. The enrollment packet sign up, we have that for you, a template. All you need to do is fill in your information. And a marketing packet. You have to have a strategy and a plan for allowing employers and drivers to get in, meaning you can't just do one big rollout and then not continuously help them to understand that you have these services available. So you can do it and enroll, let's say 10 employers, but what about the other 50 employers or the other 50 drivers that are owner operated? You want to continue the message. This is where businesses mess up. Your message is not consistent and it's not continuous. So the first column here, the software we provide it, we get you set up step by step. The second column here, we walk you through it. We give you a template and a packet. You just fill it in. And number 3, we also give you a template and a fill-in packet. We've made this very easy for you to take on this program and increase your revenues and your DOT occupational health base. It's an amazing way for you to take your practice to another level in the DOT market. What are your responsibilities? Well, of course, you have to understand DOT drug and alcohol compliance, which that would be included in getting you trained and set up. You need to provide, of course, all of the drug and alcohol testing because now you're going to have consistency in drug and alcohol testing once you set up this program. You also would be responsible for pre-employment testing, which could be an additional cost in your program, reasonable suspicion testing, which could be an additional cost in your program, post-accident and follow-up, which could be additional cost in your program. And post-accident, you need to figure out how you're going to deal with that because that could happen at any time during the day or night. You could have another person or contractor that you work with to do your post-accident, but that client belongs to you. You'll need to think about that, and we would tell you or give you some things to consider. when we help you set up your consortium. DOT exams for employers and drivers, of course, you're already responsible for those, but you need to make sure that you're tracking that information with your drivers and employers that are in your consortium. And we help you to manage that, to think about that. All of this is important to you having a successful DOT consortium that increases your revenue substantially, that increases the number of employers that you're serving, and to really give you a good solid foundation in the market. And you're, of course, tracking all drug and alcohol testing through us. We actually do it for you. You get the report and you just return it to your employer. And then we provide those employer reports. Now, one thing that you don't see on here is the Drug and Alcohol Clearinghouse, which is going to be of major importance in just a couple months, because in 2020, January 6th, they will be opening up this requirement. So a lot of your employers are going to be panicky. They're going to be frantic because they're not going to know how to make sure they're getting these reports. A lot of the consortiums have not even decided if they're going to help with the Drug and Alcohol Clearinghouse. That's a whole nother conversation, but that is why this is important, is because you could become very valuable to that employer. So here's you as the DOT provider in the consortium. You have drug testing, you have alcohol testing, you have the DOT exams, you have the drug and alcohol testing program, meaning the actual policy that we give you for you to give to your employers, and you have your employer reports. This is your responsibility, and most of this we do for you, with the exception of the testing for the drug and the alcohol and the exams. So what does it cost to have your own DOT consortium? Well, there's a one-time implementation fee, which is now early bird special, $197. That's the largest fee you will pay, and that is a one-time setup. What is included with that one-time setup? It would be training to set up and manage your consortium. That means uploading all of your drivers and your information to get you set up in our system. That means consortium management tracking. That includes reporting, that includes everything that you need. That includes giving you a random report for drivers that it's time for them, based on their employer, it's time for them to get a drug test and alcohol test. That does not include reasonable suspicion and all of that. You can make that determination, and so can the employer. But when you decide that a driver needs to have a drug and alcohol test based on reasonable suspicion, which you have the right to do that, you would report that into your own system, your own consortium, and we would keep the tracking of those types of reports as well. So by the time you need to give federal employer reporting, you would just hit a button and we would send you that report so that you can make sure that you have all of the activity for each of your employers. Also, if you're only starting with a few drivers, 20 drivers, 10 drivers, 5 drivers, you would have access to our employer national pool. So this means that if you don't have enough drivers to make a large enough pool, we would allow you to use our pool. We would include you in our pool so that your drivers and your employers are not feeling like they're always being targeted for drug testing and alcohol testing. It would be balanced so that the drivers are not being tested 3 and 4 and 5 times a year. Now, we want them to be tested, but we want it to be fair and we want it to be consistent. So we make the pools only large enough so that the drivers feel that they're being treated fair based on the law. And then our pricing model for consistent income, you get all of that, all of those things that I just talked about, the software, the management, all of that is included in the $197. Our enrollment packet for the employer and the materials, the rollout strategy and the plan with the materials, and the compliance drug and alcohol program that you need to give to your employers. So basically, you don't have to do much of anything except begin a list of the drivers that you already have. Now, your only other cost would be $695 per driver. So every time you include a new driver, you would be billed monthly for that driver for the $695. And we basically feel that that would come out of your membership fee so that it is not, it's fair, it's balanced, it's not overwhelming, but you still make a very nice size profit on each of your drivers. So what you would do is have a membership fee, but out of that membership fee or that annual fee, you would pay $695 per driver per month. And if you want to do it annually, you can do it annually as well. So if you're ready to start increasing revenues, build that foundation for your employers and your drivers, increasing your employers to hundreds and hundreds of employers and your drivers to thousands of drivers that you're servicing every year, create your own DOT consortium. Go to dothealthsystems.com, click on Get Started Now, and begin the process for setting up your own DOT consortium. Thank you for joining me today. I'm Michelle Brown, and if you need more information, please email Holly at dothealthsystems.com or call 877-793-7947. Thank you for joining me today, and we hope that you will decide to implement your own DOT consortium.